I'm Dr. Ashbran. We're going ahead and doing a dental today on this 12-year-old Labrador mix. And she came in last week for a suspected tooth root abscess. So we got her under anesthesia today, cleaned her teeth and probed them, took x-rays, which shows us what's going on underneath the gums, lets us know what we can't see. But we were able to confirm this fractured tooth right here. And if you looked at the x-rays, if we could show you that on this video, we would see an infection that was causing that mass and swelling above her face. So definitely that tooth needs to come out. The other thing though is when you do these dentals and you're able to probe these teeth under anesthesia and take x-rays, you're able to find a lot of things you don't see on just a regular exam or you wouldn't find on a non-anesthetic dental. So she actually is a ball chewer. She's been chewing balls her whole life, and she's got a broken tooth here or a worn down tooth, but it's got, again, pulp exposure. So just like a fracture, that tooth is also going to be infected and dead and need to come out. So that's the importance of really getting them under anesthesia so we can do a thorough dental exam and take some x-rays and make sure we're not missing anything that would be painful, that would be cause an infection and lead to problems later on. So we just removed that tooth that was abscessed, and you can see just the amount of disease on this root. This is one of the 3 roots of that tooth. But I'm gonna point it out. You can see this is the tip of the root. All that black is just dead and infection. So that was actually up into the mouth and where the bottom of the root was. So there's just no way you're gonna see that on your regular exam. You just need x-rays and you need to be able to probe and get in the mouth with them under anesthesia. So that's the kind of disease you're looking at when we have these kind of infections.
Hi there, I'm Chloe. I'm one of the technicians helping Dr. Ashbran with this dental today. My job as the technician is to get the whole station set up in the morning for the patient, and then when we're all ready and the patient is under, we're going to go ahead and clean the teeth while the doctor is monitoring the anesthesia. And then we do the x-rays so we can see the gum line, make sure everything is good in there, and then when the doctor is doing extractions, if there are extractions, I am in charge of monitoring the anesthesia. Alrighty, and then when we are monitoring our patients under anesthesia, it's just like monitoring humans under anesthesia. So we do have an EKG hooked up to the patient, making sure their heart rate is nice and normal. We do have oxygen saturation on their tongue, making sure that they have enough oxygen going throughout their bodies. We do have our nice respiration rate going, making sure they're breathing on their own, helping them out. Blood pressure, making sure their blood pressure is normal, and then they are in a nice tray with heat on them so they stay nice and warm, body temperature